I'm Dr. Randolph, and I've been working in OB. Well, I've been here at CMC now 4 years, and this is my first job out of residency. I did 3 years of OB training prior to coming out here, so 7 years total now. One of the most important parts of my job is the relationship I make with my patients. I feel like, especially doing OB, is a role where there's a lot of trust, and so I feel honored to have the trust of my patients and build those relationships and be able to see them have a wonderful delivery and then be able to see them and baby afterwards. One thing patients can always expect from me is a positive attitude and a willingness to listen. I think I hear from a lot of patients that they've seen other doctors, they don't always feel heard, or they just feel like they're not always listened to, and I feel that's really important to me to bring that to the table and be able to hear their perspective, hear what they want out of their delivery, and then do our best to meet their needs and give them the birth experience they're looking for. A moment that reminds me why I chose this career is actually after the delivery, after baby's born, after I'm done with all my work and I sit down at the computer and I'm just gonna write my note, and I get to sit there and think like, wow, mom and baby and dad get to be together now and get to spend some time together, and just thinking how amazing that is to have been a small part of their journey and be able to have that moment to breathe and relax and be thankful that everything was safe and healthy, and also be so thankful for the wonderful team that I get to work with. I've got amazing nurses, amazing assistants, other amazing doctors I work with, and so there's always that moment, just that moment of calm kind of after the storm where you get to think back and reflect, and those are the moments that I'm so glad I do OB. The connection I built with patients as a rural OB, I think, is really unique. There's a lot of patients that know me in the community, who I see outside of work, but when I'm seeing them as their doctor, as their OB provider, I'm putting on my work hat, and we're here to provide them excellent care. And I feel really proud of the care that we can provide. I feel honored they choose us to give them care, and I think that shows trust, that they believe in what we do, and that we can provide them with service that's really excellent. If my coworkers had to describe me in one word, it would probably be exuberant. I think I often bring a loud voice, a lot of energy, a lot of smiles to the team. As a newer provider, I just love what I do, and I think exuberance would be a fair assessment of me and my role. I think the best compliment a patient could give me is when they say that they want to come back and have their next baby here and have me provide their OB care again. I think having repeat patients is just a joy, and the fact that they felt well cared for, in fact so well cared for that they would want to come back and want to have that experience here and have me as their provider again, you can't ask for better than that. A little encouragement that I'd give to expecting moms is that the hard parts you're largely going to forget, but the joyful parts you will remember. And I look back at my wife and my experience having kids and all the joyful moments that we remember, and then I think back to all my patients that I've seen now several years after they've had their delivery, and they remember a lot of the joy, the fun, and yes, there's hard moments, but honestly those pass. But the joy sticks with you. What makes our OB team work so well together is, number one, we work really closely together. We're a small team, and I think that really benefits us. I've worked at much bigger hospitals with much bigger teams where you often don't know people you're working with very well. You might have introduced yourself once or twice, but here we're part of a team where we work together a lot, day in, day out, and we get to know each other really well. We know our strengths, we know our weaknesses, we know how to communicate, and we really enjoy working together as a team. These are people that I have learned to trust, and they've learned to trust me, and so that teamwork is built on mutual trust and strong communication. At the end of the day, what matters most to me is that, that we have a safe and healthy delivery as best we can. And if there's a delivery that I don't even need to be a part of because everything's going great, that's perfect. I view my role as to be there for encouragement, supervision, backup, but if I don't need to even really step in, awesome. If I do, and I want to do so and make sure that I'm doing that for the safety of baby, for the safety of mom, to make sure everything goes well, and I'm ready to do that, but the more safe, healthy, happy deliveries we can have, the better.